Department of Pharmacy, Bangladesh. I owe my gratitude to you, madam, to welcome you at this webinar. Cyber Chanda, Assistant Professor, Department of Physical Education, Jessore, Bangladesh. I welcome you, sir, to emphasize your views to lead us to a regulated way. Last but not the least, I heartily welcome all the participants, all the listeners, all of you to grace this webinar, and I hope a grand success of this webinar. Thank you all.
You please unmute your mic.
Thank you very much, Principal Madam, for your highly encouraging words. And now, as the organizing secretary of the One Day International webinar, I would like to welcome all the participants to the One Day International webinar on combating COVID-19 by exercise science, nutrition, and hygiene, organized by the Department of Physical Education of Netaji Subhas Mahavidyalaya, Udaipur, Gomati district, Tripura, India. Welcome to all of you once again. A very good morning. In the wake of the current and unprecedented COVID-19 pandemic, on 20th March 2020, the Director General of the World Health Organization emphasized the importance of appropriate diet and lifestyle measures, including adequate lifestyle measures, including adequate nutrition to protect the immune system. This is, of course, not a substitute for adherence, first and foremost, to key public health and medical advice on prevention. However, as vast sections of the society spend more and more time at home, it provides an opportunity to focus on strengthening the four lifestyle pillars of sleep, mind, exercise, and diet. To enlighten us more on this topic, our resource persons are very well and they are very deserved of this, and therefore they shall be enlightening the webinar on these issues. Now, I would like to request our chief patron, Professor M.K. Singh, the Vice Chancellor of Tripura University, to deliver his address.
Good morning to everybody. I am audible? I am audible?
Yes, sir. Yes, sir.
You are audible.
Okay. Good morning to everybody. First of all, I like to congratulate the Principal Netaji Subhas Vidyaniketan, Udaipur, for having this one webinar, that is combating COVID-19 by exercise, science, nutrition, and hygiene. So the COVID has become a pandemic and everyone is afraid of that. We don't know any symptom of this COVID-19. Whatever the things we are coming through across the examination, we are proposing every day new and new symptom for this COVID. But we don't know actual position of this COVID and how the COVID will go and how long it will persist. It is also not known to us. We are doing the sanitization, even though the World Health Organization has told that the sanitation is also not effective. Means we are not in a position to recognize the culprit to whom we are going to treat. So this medical science also having this challenge to find out this vaccine for this virus. Still, we are not in a position to get any virus or vaccine for the virus. But anyhow, we are trying our best. If medicine is not appropriate or not found correct position, then many other systems are there, like the exercise science, nutrition, and hygiene. These are some important things which can enhance the immunity among these people. And this immunity can fight with this COVID-19. And many things, Patanjali has also told that uh, some of the juice of the one of the herbal that is going to boost the immunity of the persons. So now everyone is trying to get this rid of this COVID, and how to get this rid, we don't know. So every scientist, every doctor, and every this medicine persons and the government organization, everyone is trying to get rid of that and to how to get rid of this problem. But still, we are in the dilemma. We don't know when it will go. Our lockdown was there. 3 lockdowns were there. After that, the unlockdown 1, unlockdown 2 started. Afterward, again, this lockdown has been imposed that the school and colleges will not open till the 31st July 2020. So this also gives a problem. So we don't know. But this webinar definitely gives the input to these persons who are interested and looking after this combating of this COVID-19. So these are the things where we are going to have. This NS Vidyalaya has done this work. I definitely congratulate her, because in this time our colleges are closed. We have to work from home. So how much we can do work from home, because this internet facility to the students and the actually the Android phones, these are also the one of the requirement for the online courses, but all the students have no such facility. But even though this webinar is one of the way by which we can communicate our views, or communicate our ideas to among the people, among the students and the faculty members, and to our society fellow members, so that we can do better for getting the things better and better. And most important here, that the precaution, the prevention is better than cure. It is one of the proverb we know. So this precaution, whatever the precaution government of India and the government of Tripura and government of other governments are also providing, we must have to follow, because without following that we cannot make ourselves safety. So if we are going to follow the directions given by the MHRD, UGC, and this your MHA, everyone, so if we are going to follow, then we can make ourselves protect and also protect the others. If I can save myself, I will also save others. If I am not getting to save myself, I cannot save others. So these guidelines we have to follow, and in these guidelines following, then we can cope our this COVID-19. And we don't know actually when this vaccine will be there. I think Patanjali has claimed that they have produced one vaccine or this medicine for the COVID-19, but I don't know how much it is correct and how much it is tested. But anyhow, we are not going to get till this medical science is going to give the appropriate medicine for that. We are not in a position to say anything definitely about this COVID-19. So this webinars is one of the challenges is being provided by the COVID, and it also gives the opportunity to us, because webinars, earlier we are not very much conversant about the webinars and online workshops, but nowadays the webinars and online workshops are only the way by which we can communicate our views and communicate our ideas to other people, and we can get the connected with them. So with that, I like to congratulate and thank this principal and other organizations, those who have done this work, because any work requires the tireless effort, and without tireless effort, we cannot get the success. So I think that this webinar will get the grand success. With these words, I thank you all. Namaskar. Jai Hind.
Thank you, sir, for always furnishing support and encouragement to the cause of knowledge dissemination to all of us. And we shall always look forward to your kind encouragement in the near future. So please keep enlightening us all the time, sir. We look
Okay.
forward to that.
Thank
Thank
you.
you, sir. And please be a part of our seminar, our webinar, till the end. We shall be looking forward to your active participation at this webinar, sir.
Okay. Okay.
Thank you, sir. Now, I would like to request and invite our Director of Higher Education, Sri Saju Wahid, sir, to address this webinar.
Very good morning to all. Respected Chief Patron, Vice Chancellor, Tripura University, Sri M.K. Singh, respected Principal Ridatas Naik, and all other participants who have joined in this great opportunity given by NSM Udaipur from across the country. I welcome you all, and I sincerely extend my sincere thanks and gratitude to the college authorities for welcoming me also to be part of this webinar. Now, webinar becomes a norm ahead, and I am getting a chance to attend one or other webinar on a weekly basis, maybe like a daily basis. So it is really a wonderful opportunity to listen to the great speakers and academics across the country, be a part of it. The topic, I really congratulate the college authorities taking such a beautiful topic by exercise science and hygiene. Till now, honorable vice chancellors have told that till now we have successful medicine or even a vaccine for combating COVID-19. So, or in COVID care centers, what we are following is to improve the immunity power or of the patient to prevent them from getting into contact of these things. And second thing is to provide this patients with proper complications. This is the only protocols being followed by the health authorities in combating COVID-19 as of now, because we don't have a proper medications to this, and that is a major threat in case of COVID-19. And these three things, exercise, nutrition, and hygiene, these three pillars are the major protocol which we are following. For those civilians and for those people who are not yet affected by COVID-19, it is advised to have proper hygiene so that we can prevent this in coming in contact with such cases. So the mask, sanitizers, hand washing facilities, the part of hygiene became a new norm of our lifestyle. And in addition to that, the nutrition is an important thing. Government across the country or even across the world is providing people with proper nutrition so that we can improve their immunity and thereby reducing the issues of getting in contact with such diseases. We have seen that there are so many asymptomatic cases of COVID-19. The people are not knowingly getting in contact with the COVID-19, and after 14 days, without any medication, it is getting rid of that, and there is no issues, there is no complications happening in so many cases. This is one of the major steps which need to be thought of. So being academicians and being the representative of academia, it is our responsibility to think more about this area and discuss more about these areas and come up with new suggestions and give people new ideas in combating this kind of diseases. So it shows the importance of this kind of things which is important for our lifestyle. So with these words, I conclude my speech, small speech, and I would love to hear from others rather than to preach from my side. Being an administrator, I would really like to listen to the academicians and real professors who are across the board. So I really thank to the all speakers who have consented and who have participated in this webinar. And I am once again thank every organizer of the college authorities. So wish you all the best. I hope it will be a wonderful webinar.
Thank you very much, sir, for your inspiring words. Your unstinted devotion towards the cause of education is always an example for us to strive forward, sir. Thank you, sir. Now, I would like to request our, our first resource person, Professor Muhammad Khairul Islam Khan, to share his words and views and enlighten the participants of the webinar on combating COVID-19 through exercise science.
Yes, thank you very much. Uh, Chairman of the seminar, Honorable Vice Chancellor, faculty, guests, terrorists, and my dear students. Uh, Good wishes to you, best wishes to you. It's really very nice title. We have chalked out the title. Uh, this is combating COVID-19 by exercise science, nutrition, and hygiene. Uh, you know that the whole world are fighting against this COVID-19. We don't know when the impact of this COVID-19 will be stopped, but people are trying their best to cope it by using exercise science. Since we're the people from the physical education, we know how to protect it. At least, if not completely, at least we can resist the impact, bad impact of this virus. We know that lots of viruses are there in the world. We used to take antibiotics and it will become all right. But in the case of this coronavirus, it is very difficult to cope with this virus. So we have to be strong. We have to take the help of the exercise. By exercising ourselves, we can be stronger so that we can resist the impact of this type of virus. The students of physical education college, all of you know that the heart and lung is the very important factor in resistance with this coronavirus. Health, if you are having a very good health, definitely your health, your heart will act as a good something good for health, and at the same time your lung will be acted very nicely. This virus attacks the lung fast, so that lung becomes inactive and the oxygenated blood is not able to come to the lungs and people die. That's why we know that the heart, the heart is always pumping, the systolic and diastolic system. This deoxygenated blood goes to the lungs through pulmonary artery, and from there, after purification by lungs, the blood comes to the different types of muscles, and muscle works. Unless muscle gets oxygenated blood, it never works. You know, the endure people, the good athletes, they are having a good strength to resist against this type of virus. The cricketer, especially the footballer, they used to play 90 minutes football, but if required, again they play 15 plus 15 minutes extra time. From where they get this type of energy? Individual athletes, they are having a reserve area to get this type of energy. We have reserve energy in the lung, in the muscle, and in the adipose tissue. From there, the athlete get this type of energy. So, sports person, good athlete, they become very active to resist this type of virus. I would say that be safe, be strong, and stay at home. Without this, we do not have any other option to resist to protect this type of virus. The strong people, the athlete, strong athlete, they are having a very good option to resist themselves. Unless you are vulnerable, the people from the above age of 40 or 50, they are in the age of vulnerable. So the athletes should have to have maximum time engaged in the activities. The World Health Organization recommended for the 6 to 70 years old people at least 50 minutes activities and 75 minutes activities for mid type of people and 175 150 minutes for good athlete. So everybody has to take care of their health, especially aerobic energy. You have to have your aerobic exercise within the home. You can have your ergometer, bicycle, then and other activities like weight training, everything you can have at your home. So try to be fit by using this exercise, by doing this exercise, and try to get rid of this type of uh, virus. I hope this seminar will be a bit enlightened by this. Students will be enlightened by having the information of coronavirus and impact. And I wish that the, the organizer of the seminar will be definitely be benefited for this. So the participants, they are taking part in this seminar. I I wish them and from Bangladesh, Dr. Nasim Reza, Dr. Saibal Chandra, and Dr. S. Nirus Paul. I wish all of them to have a very good time. So, thank you all. Thank you.
Thank you very much, Professor Khan, for elucidating in a layman's words how to understand the importance of a healthy lung and heart for a healthy life. Yes, sir, it is true indeed that weight training and the success to a fitful life can be engaged even in the domains of one's home. Therefore, although pandemic can restrict us to the boundaries of our home, our strive for fitness should not stop us. Thank you very much, sir, for enlightening the webinar. And, sir,
Thank you.
I
Thank
must beg your pardon for not being able to introduce in a proper way before you deliberated on the issue of combating COVID-19 through exercise, through hygiene, and through nutrition. So, now may I introduce you the speaker who has just addressed us, that is Professor Muhammad Khairul Islam Khan. Sir is presently working as a chairman in the Department of Physical Education, and he is also the Dean of the School of Education and Physical Education, Uttara University, Dhaka, Bangladesh. Mr. Khan has also served in Jahangir University, Dhaka for 35 years as the Director of Physical Education. Sir has also published several books on physical education for the undergraduate students. He has completed MPEd, Diploma in Coaching, BPEd, and Bachelor. We are very much privileged to have Professor Muhammad Khairul Islam Khan as our resource person for today's webinar. And I hope the audience have been truly inspired by his sharing. And we also look forward to hear from you more soon in our upcoming webinars, sir. Thank you very much, sir. Now, I would like to request our next speaker, Professor Muhammad Naseem Reza. Sir is an associate professor and ex-chairman in the Department of Physical Education and Sports Science. He is also the ex-dean of the Faculty of Health Science, Jashore University of Science and Technology, Jashore, Bangladesh. Sir has a BSS honors as well as MSS in economics from the University of Rajshahi, Bangladesh. Sir has BPA from the National University of Dhaka, Bangladesh, and MPA from the University of Calcutta, West Bengal, India. And Sir has completed his PhD from the University of Kalyani, West Bengal, India. May I now request Professor Naseem Reza to please address the webinar.
Thanks a lot. Honorable Chairperson, do you hear me?
Yes, sir. Yes, sir. You are audible to us, sir.
Honorable Chairperson of International Webinar entitled Combating COVID-19 by Exercise Science, Nutrition and Hygiene, organized by Department of Physical Education, Tripura, Netaji Subhas Mahavidyalaya, Tripura. Here also present Honorable Vice Chancellor of Tripura University, Mr. M.K. Singh, and also present Director Higher Education, Organizing Secretary of the webinar, other research person, especially Professor Khairul Islam Khan, who is the most experienced physical educationist in Bangladesh. Other guests, participants, and researchers. I wish you a very good morning. The aspect of today's webinar on said title would be discussed all the resource person, but my focus would be particularly on general hygiene to combat COVID-19. As I know, most of the people of Tripura and West Bengal speak in Bangla as their first language. And the Bangla is the mother tongue of our country, Bangladesh. It's the great thing at binding together. So for better understanding and learning, with the permission of chairman of the session, I would like to deliver my speech in Bangla. May I proceed, sir? Hello.
Yes, sir. Yes, sir. Please proceed.
শুভ সকাল। আজকে আমরা এক অদৃশ্য শক্তির বিরুদ্ধে লড়াই করছি। আপনি বাঘের সাথে যুদ্ধ করতে পারবেন, আপনি সিংহের সাথে যুদ্ধ করতে পারবেন, হিংস্র প্রাণী হলেও তাদের সাথে টিকে থাকা সুযোগ আপনার আছে যদি সেভাবে কৌশল অবলম্বন করা যায়। কিন্তু আমরা যে জীবাণুর সাথে লড়াই করছি সেটি অদৃশ্য এবং এটি বিশ্বব্যাপী ছড়িয়ে পড়েছে প্রায় প্রতিটি দেশেই এবং মহামারী আকার ধারণ করেছে অধিকাংশ দেশে। আমরা সবাই জানি যে এর এখনো কোনো ভ্যাকসিন বের হয়নি। চেষ্টা চালাচ্ছে বিশ্বব্যাপী প্রতিনিয়ত গবেষকরা, চেষ্টা অন্ত নাই, প্রতিটি দেশ থেকেই চেষ্টা চালানো হচ্ছে। কিন্তু তার পূর্বে আমাদের বেঁচে থাকা লড়াইয়ের সাথে যে কয়েকটি বিষয় অতি গুরুত্বপূর্ণভাবে সংযুক্ত। তার ভিতরে হাইজিন একটি অন্যতম। এর বাংলা অর্থ হাইজিন শব্দের স্বাস্থ্যবিধি, অন্যভাবে বলা যায় ক্লিনলিনেস। সহজ ভাষায় আজকের আলোচনার জন্য যদি আমি বলি, পরিচ্ছন্নতা বিধি। অর্থাৎ আমরা এই মহামারীর সময় নিজেকে কিভাবে পরিচ্ছন্ন রেখে নিজেকে সুরক্ষা করব, সেটি হচ্ছে আলোচনার বিষয়। আদার্স রিসার্চ পার্সনরা অন্য এরিয়া নিউট্রিশন এবং এক্সারসাইজ সায়েন্স সম্পর্কে কভার করবে, আমি হাইজিন নিয়েই বলছি। বিশ্বব্যাপী যেহেতু ছড়িয়ে পড়েছে এই মহামারী, স্বাভাবিক কারণে ওয়ার্ল্ড হেলথ অর্গানাইজেশনও বেশ কিছু তাদের গাইডলাইন দিয়েছে হাইজিন সম্পর্কে। প্রতিনিয়ত বলা হচ্ছে বারবার ঘন ঘন সাবান পানি দিয়ে হাত ধুতে এবং 20 সেকেন্ড ধরে হাত ধুতে, বলা হচ্ছে মাস্ক ব্যবহার করতে, বলা হচ্ছে সামাজিক দূরত্ব সোশ্যাল ডিস্টেন্স মেনটেন করতে, এবং হাঁচির সময় কাশির শিষ্টাচার হাসির শিষ্টাচার মেনে চলতে বলা হচ্ছে। এখন আমার কাছে মনে হয়েছে যে বাস্তবতার নিরিখে বিষয়গুলো একটু আলোকপাত করা দরকার। আমরা টেলিভিশনে শুনছি বা বিভিন্ন মিডিয়ার মাধ্যমে আমাদের সামনে কিছু বিষয় আসছে, কিন্তু এটিকে আমরা অ্যাপ্লিকেবল করব কিভাবে, সেটি এখন আমার কাছে মনে হয় আলোচনার মূল বিষয় হওয়া উচিত। প্রথমত আমি মনে করি যে আমাদের প্রত্যেকের মনকে সবসময় সন্দেহ প্রবণ করতে হবে এই মুহূর্তে অজানা শত্রুটির বিরুদ্ধে লড়াইয়ে। সন্দেহ প্রবণ বলতে আমি বোঝাচ্ছি যে কোথায় ভাইরাসটি আছে। মনে করতে হবে আমার আশপাশে সব জায়গায় জীবাণু ভাইরাসটি ছড়িয়ে আছে, আমাকে সতর্ক থাকতে হবে এবং আমি প্রতিনিয়তই জীবাণুর সাথে লড়াই করছি, এটি মনে মনে ভাবতে হবে। বলা হচ্ছে হাত ধুতে বারবার কমপক্ষে 20 সেকেন্ড ধরে। এখন এই 20 সেকেন্ড আমি তো আমার অভিজ্ঞতা থেকে বলি যে মাঝে মাঝেই মনে হয় 10 কি 15 সেকেন্ডের সময় পানি দিয়ে হাতটি ওয়াশ করে ফেললাম। আমি কিভাবে 20 সেকেন্ড কাউন্ট ডাউন করব, কখন থেকে করব, এটি কিন্তু একটি বিষয়। আপনার হাতে আপনি সাবান বা হ্যান্ড ওয়াশ বা যে কোনো ডিটারজেন্ট পাউডার ক্ষারযুক্ত যে কোনো কিছু দিলেন, দিয়ে আপনি যখন ফেনা হয়ে গেল কবজি পর্যন্ত ভিজিয়ে নিলেন, তারপর আপনি 20 সেকেন্ড হিসাব করুন, কারণ আপনার কবজি পর্যন্ত ওয়াশ করতে হবে। সাবানটি হাতে দিয়েই আপনি 20 সেকেন্ড কাউন্ট ডাউন করা শুরু করলেন, সেটি কিন্তু যথার্থ নয়। এখন এই 20 সেকেন্ড আপনি তো স্টপ ওয়াচ নিয়ে সামনে নেই, স্টপ ওয়াচ সামনে থাকলে আপনি স্টপ ওয়াচ নিয়ে দেখতে পারতেন। আসলে এর একটি কৌশল আছে ফিজিক্যাল এডুকেশন এবং স্পোর্টস সায়েন্সে ভাষায়। যখন বিভিন্ন সেকেন্ড কাউন্ট করা হয় সেগুলি বলা হয় 1001, 1002, 1003, 1004, 1005, এভাবে আপ টু 20 কাউন্ট করলেই কিন্তু 20 সেকেন্ড হবে। আমরা আরও নিশ্চিত হওয়ার জন্য এদিকে 22, 23, 24, 25 পর্যন্ত প্রয়োজনে দিই। এবং একই সাথে আরেকটি কাজও করা যায়, 1000 না বলে পজ দিয়ে দিয়ে যদি বলি 1, 2, 3, 4, এভাবে কাউন্ট করলেও 20 সেকেন্ড কাউন্ট করা যায়। মাস্ক ব্যবহার করতে হবে। এখন কোন ধরনের মাস্ক তারা ব্যবহার করবে আমরা মিডিয়াতে নানাবিধভাবে শুনছি, কিন্তু আমরা সাধারণ মানুষ N95 মাস্ক কত দাম দিয়ে কিনে আমাদের পক্ষে ব্যবহার করা সম্ভব নয়। সার্জিক্যাল মাস্কও এক শ্রেণীর মানুষের পক্ষে বা মধ্যবিত্ত পর্যন্ত ভাবলেও নিম্ন মধ্যবিত্ত বা তার নিচে মানুষদের পক্ষে প্রতিদিন ওইভাবে সার্জিক্যাল মাস্ক ব্যবহার করা যায় না। কাপড়ের মাস্ক আমরা যেটা শুনছি এবং বিভিন্নভাবে পরীক্ষা করে গবেষণাগার থেকে বলা হয়েছে 3 লেয়ারের যদি কাপড়ের মাস্ক ব্যবহার করা যায়, সেটা পপলিন কাপড়ের হতে পারে বা গেঞ্জি কাপড়ের হতে পারে। আপনি বাড়িতেই বানিয়ে নিলেন 3 লেয়ারের মাস্ক, প্রতিদিন ব্যবহার করে একাধিক থাকলো ধুয়ে নিয়ে ব্যবহার করতে হবে। একদিন ব্যবহার করে ধুয়ে ফেলতে। এখন বাইরে যাওয়াটা একটা যুদ্ধ করার সামিল। আপনারা খেয়াল করে দেখবেন আমরা আমাদের সমস্ত কাজ কিন্তু এখন 1.5 গুণ 2 গুণ সময় লাগছে আমাদের প্রস্তুতি গ্রহণ করতে, আমাদের নিজেকে পরিচ্ছন্ন রাখতে, নানাবিধ কারণে কিন্তু লাগছে। বাইরে যাওয়ার প্রস্তুতি সময় কিছু জিনিস কিন্তু খেয়াল রাখতে হবে, যারা সচেতন, যাদের সম্ভব, এবং চেষ্টা করবেন প্রত্যেকেই এটি করার। যেমন বাইরে যাওয়ার সময় অবশ্যই একটা অতিরিক্ত মাস্ক, আপনার ছোট ব্যাগ বা ক্যারিয়ার যেটা বহন করছেন সেখানে একটু অতিরিক্ত মাস্ক নিয়ে নাও। এবং এখানে একটি শব্দ এখানে ব্যবহার করা হয়, বাইরে যাওয়ার সময় মনে রাখতে হবে SMS, এস ফর স্যানিটাইজার, এম ফর মাস্ক, আর দেন এস ফর সোশ্যাল ডিস্টেন্স, দ্যাট ইজ ফিজিক্যাল ডিস্টেন্স। এখন মাস্ক আপনি অতিরিক্ত নিয়ে নিলেন, আপনার সাথে একটি স্যানিটাইজার বা সাবান সঙ্গে নিলেন। আমরা আমাদের মতো দেশসমূহে মোড়ে মোড়ে সরকার ব্যবস্থা করে রেখেছে বা সবাই ব্যবস্থা করে রেখেছে, এটা ভাবার কোনো অবকাশ নাই। নিজেকে সুরক্ষার জন্য নিজেই ভাবতে হবে। যাদের পক্ষে সম্ভব স্যানিটাইজার, অ্যালকোহল বেস স্যানিটাইজার সঙ্গে নেওয়া, অথবা সাবানের গুঁড়ো, পাউডার, ডিটারজেন্ট পাউডার একটা ছোট বোতলে নিয়ে নেওয়া, নিয়ে যেখানে জল পাওয়া যাবে বা পানি পাওয়া যাবে সেখানে হাতটিকে ওয়াশ করে নেওয়া সন্দেহ হলে। আর সবসময় খেয়াল রাখতে হবে সোশ্যাল ডিস্টেন্সিং এর যে ব্যাপারটি, কখনো বলা হচ্ছে ওয়ার্ল্ড হেলথ অর্গানাইজেশন আমার জানা মতে এবং স্পষ্টভাবেই বলেছে এদিকে 2 মিটার ডিস্টেন্স মেনটেন করতে, কিন্তু
Sir, Professor Naseem Reza, sir, could you please unmute yourself? Sir, Naseem Reza, sir, আপনি আপনার মাইকটা একটু আনমিউট করে দিন, আমরা আপনাকে শুনতে পাচ্ছি না।
হ্যাঁ,
Yes, sir.
ইয়েস
Yes.
ইয়েস, আমি আমি
স্যার আপনি
আমি
আপনার
করেছি আমি
ফোনটা,
করেছি
হ্যাঁ
আমি
ঠিক আছে,
করেছি তো,
ঠিক আছে,
মিউট
হ্যাঁ হ্যাঁ, একদম, থ্যাংক ইউ, থ্যাংক ইউ স্যার, থ্যাংক ইউ স্যার।
এক্সট্রা মাস্ক সঙ্গে রাখা, এবং আমি সোশ্যাল ডিস্টেন্স মেনটেন করা। সোশ্যাল ডিস্টেন্স বলতে এখানে আমি রিপিট করছি, সম্ভবত আমি একটু মিউট হয়ে গেছিলাম। রিপিট করছি এই জন্যে যে আপনাকে সবসময় ভাবতে হবে যে আপনি সতর্ক, কিন্তু আপনার পাশের মানুষটি কতটুকু সতর্ক। আপনার পাশের মানুষটি আপনার গায়ের
আপনি আবার আনমিউট হয়ে গেছেন, আপনি আবার আনমিউট হয়ে গেছেন।
আমি তো কিছু করছি না, আমি করছি না তো আমি।
হ্যাঁ হ্যাঁ, এবার ঠিক আছে, এবার ঠিক আছে।
তো না বলার অভ্যাসটি খুব শক্তভাবে করতে হবে। পাশের মানুষটি নিজের কাছাকাছি আসতে গেলে তাকে বলতে হবে যে ভাই তুমি আমার পাশে এসো না, তুমি ডিস্টেন্সটা মেনটেন করো। কারণ যেহেতু আমাদের এই অঞ্চলের মানুষ আমরা অতটা সচেতন নই, এটি আমাদেরকে সতর্ক রাখতে হবে। বাইরে থেকে যখন ঘরে ফিরবো তখনও কিন্তু একটি অত্যন্ত গুরুত্বপূর্ণ বিষয় কিন্তু এখানে আছে, যে কিভাবে আমি আমার ঘরে ঢুকবো। ঘরে ঢোকার সময় অবশ্যই বয়স্ক যে মানুষগুলি ঘরের ভিতর আছেন তাদেরকে নিরাপদ জায়গায় রাখার ব্যবস্থা করতে হবে। আমি যেন সরাসরি তাদেরকে ফেস না করি, সেই চেষ্টা সব থাকতে হবে। জুতো নিয়ে ঘরের ভিতরে ঢোকার কথা বলা হচ্ছে, সেই ক্ষেত্রে আমার মনে হয় যে ব্লিচিং পাউডার মিশ্রিত জল দিয়ে একটু পাপোশ ভিজিয়ে রেখে জুতোটাকে পরিষ্কার করে বাইরে রাখার কথা বলা হচ্ছে। বাইরে রাখার পরিবেশ সবার ক্ষেত্রে নাও থাকতে পারে, ভিতরে নিয়ে এসে একটি পলিথিনে মুড়িয়ে জুতোটি রেখে দিতে হবে, সবচেয়ে ভালো হয়। তারপর সরাসরি আপনি যদি বাথরুমে চলে যান, আপনার ব্যবহার্য সমস্ত কাপড় চোপড় গুলি ডিটারজেন্ট পানি দিয়ে ভিজিয়ে রেখে ওয়াশ করে ফেলা, এবং নিজে স্নান বা গোসল সেরে ফেলে আবার বাইরে আসা। বাইরে এসে গরম জল দিয়ে গলাটা একটু ভিজিয়ে নেওয়া, গার্গেল করা, এবং একটু গরম জল খাওয়া, এটি খুব জরুরি আমার কাছে, আমি যতটুকু বুঝতে পেরেছি। অন্য মানুষ যদি আপনার ঘরে কোনো কারণে প্রয়োজনে ঢুকাতে হয়, সেটি কিন্তু একটা বাস্তবতা। আপনার ইলেকট্রিক প্রবলেম হয়েছে, একটা ইলেকট্রিশিয়ান ঢুকানোর দরকার। আপনার পানির কলের সমস্যা হয়েছে, একটা প্লাম্বার ঢোকানো দরকার, সেক্ষেত্রে তাকে ঢোকানোর সময় কিন্তু আপনাকে একই রকম সতর্কতা অবলম্বন করতে হবে। সেই ভদ্রলোক মাস্ক নিয়ে আসছে কিনা, সে কিভাবে আসছে সেটাকে আপনাকে আগে নিশ্চিত করতে হবে, এবং তাকে একইভাবে তার পাটি ওই ব্লিচিং পাউডার মিশ্রিত জল দিয়ে পরিষ্কার করিয়ে আপনার ঘরে আপনি ঢোকানোর ব্যবস্থা করুন। এবং আপনি নিজে থেকেই একটি মাস্ক এক্সট্রা এবং প্রয়োজন হলে হ্যান্ড গ্লাভস আপনার সামর্থ্য যদি হয় তাহলে আপনি রেডি রাখুন। তাকে স্যানিটাইজার দিয়ে হাত পরিষ্কার করান এবং তাকে তারপরে ঘরে ঢুকতে দিন। যেখানে যেখানে সে কাজ করে ফিরলো, যেখানে যেখানে স্পর্শ করলো, সেই জায়গাটি আবার স্যানিটাইজার দিয়ে পরিষ্কার, অ্যালকোহল বেস স্যানিটাইজার দিয়ে বা ডেটল পানি দিয়ে আপনি পরিষ্কার করে। এখন আমাদের আরেকটি খুব গুরুত্বপূর্ণ বিষয় হচ্ছে যে আমরা মোবাইল ফোন প্রত্যেকেই ব্যবহার করি। এই মোবাইল ফোন কিন্তু একটু জীবাণু বহনের একটি বড় মাধ্যম হয়ে দাঁড়িয়ে। মোবাইল ফোন আসক্তি একটি মানুষের, যেটা নোমোফোবিয়া বলা হয়, এক ধরনের রোগে এই হচ্ছে। হঠাৎ হঠাৎ আমাদের কাছে মনে হয় মোবাইলটি কোথায়, মোবাইলটি কোথায়, মোবাইল সাথে না থাকলে যেন অস্বস্তি বোধ করি। অর্থাৎ এখন সম্পূর্ণ জীবনের একটা সঙ্গী হয়ে গেছে মোবাইল। কিন্তু সেই মোবাইল ফোনটা আমার হাতে যদি গ্লাভস পরাও থাকে, সেই গ্লাভস দিয়ে আমি যখন ধরছি সে কিন্তু জীবাণু আক্রান্ত হচ্ছে। বারবার বলা হচ্ছে হাত আপনি কোনো অবস্থাতেই মুখের কাছাকাছি নেবেন না, কারণ এটি মুখ, নাক এবং চোখ দিয়ে প্রবেশ করে। তাহলে আমি সেই মোবাইল ফোনটি যখন আমার কানে ধরছি তখন সেটি কিন্তু আমি কিন্তু আক্রান্ত হওয়ার সুযোগ সম্ভাবনা কিন্তু বেড়ে যাচ্ছে। যার কারণে এই মোবাইল ফোন ব্যবহারের পূর্বে যদি সম্ভব হয় বাজারে মোবাইল ফোনের পলিথিনের কভার পাওয়া যায়, পলিথিনের ভিতরে ভরে সেটি নিয়ে আপনি মোবাইল বাইরে গেলেন, ব্যবহার করলেন, প্রয়োজনে বাইরে বাড়িতে এসে পলিথিনটি আবার পরিষ্কার করে নিন। সাধারণ পলিথিন মুড়িয়েও কিন্তু মোবাইল ব্যবহার করা যায়। সেইভাবে এটি পরিষ্কার রাখার চেষ্টা করুন এবং মোবাইল ফোনটিকে অবশ্যই আপনি ঘরে এসে পরিষ্কার, নিজের হাত পরিষ্কার করে তারপর ফোনটিকে অ্যালকোহল বেস স্যানিটাইজার দিয়ে আপনি পরিষ্কার করে নিন। আর এই সময়টা বাইরে যাওয়ার সময় সতর্ক রাখতে হবে। এখন পাবলিক ট্রান্সপোর্টে অধিকাংশ মানুষ ব্যবহার করে, কিন্তু সাথে পর্যাপ্ত টিস্যু রাখতে হবে। টিস্যু দিয়েই আপনি হ্যান্ডেল, বাসে উঠছেন সে বাসের হ্যান্ডেল ধরে যাবেন, যেখানে স্পর্শ করবেন সেখানে টিস্যু রাখার চেষ্টা করবেন। টিস্যু দিয়ে আপনি যে জায়গাগুলি ধরবেন সেগুলি টিস্যু দিয়ে ধরবেন। এবং এই সময় যদি যাদের সামর্থ্য আছে, যদি তার নিজস্ব গাড়ি থাকে, ড্রাইভার বাদ দিয়ে নিজেই গাড়ি চালিয়ে যাবেন কর্মস্থলে। মোটর বাইক যদি থাকে মোটর বাইক ব্যবহার করবেন। যদি ডিস্টেন্সটি কম হয় প্রয়োজনে একটি বাইসাইকেল কিনে নিয়ে নিজে চলবেন। একা একা অন্য কারোর সাথে না চলতে পারলে সেটি সবচেয়ে ভালো হয়। এখন বারবার ক্ষারযুক্ত আমরা যখন সাবান বা ডিটারজেন্ট পাউডার দিয়ে হাত ধুবো 20 সেকেন্ড ধরে, তখন কিন্তু এখন একটা স্যানিটাইজার দিয়ে হাত পরিষ্কার করবো, একটা প্রশ্ন কিন্তু হয়ে দাঁড়িয়েছে এটি আবার ভবিষ্যতে আমাদের স্কিনে প্রবলেম হতে পারে। স্কিনে প্রবলেম হওয়ার সম্ভাবনা কিন্তু যথেষ্ট রয়েছে। যার কারণে যে কোনো ধরনের লুব্রিকেন্ট বা ভ্যাসলিন জাতীয় বা আপনি তেল, সরিষার তেল দিলেও হবে রাত্রে শোয়ার সময়, বা আপনি একটু বিশ্রামে যাচ্ছেন একটু লম্বা সময়ের জন্য, সেই সময়টা আপনি হাতে কিন্তু এই ধরনের লুব্রিকেন্ট ব্যবহার করবেন। আমার মনে হয় আমি যতটুকু সম্ভব আমার পক্ষে আমি একটু কভার করার চেষ্টা করেছি। আমি আপনাদেরকে যিনি সঞ্চালক উনি আমাকে এক্স দিন বলেছেন। ঘটনাচক্রে আমি গত পরশু দিন 1 তারিখে নতুন দায়িত্ব 2 বছরের জন্য আবার ডিন হিসাবে ফ্যাকাল্টি অফ হেলথ সায়েন্স যশোর ইউনিভার্সিটিতে আমি দায়িত্ব গ্রহণ করেছি গত 1 তারিখে। অর্থাৎ আমি বর্তমানে ডিনের দায়িত্বেই আছি। আমি সেই ফ্যাকাল্টির পক্ষ থেকে, পরিশেষে আমার বিশ্ববিদ্যালয়ের পক্ষ থেকে এবং আমার বাংলাদেশের পক্ষ থেকে আপনাদের শুভেচ্ছা জানাচ্ছি এবং আমার বিশ্ববিদ্যালয় তথা বাংলাদেশে আপনাদের সকলকে আমন্ত্রণ জানাচ্ছি। সকলকে আবারও ধন্যবাদ। আমি একটু হয়তো বেশি সময় নিলাম, সমানে সুন্দর দৃষ্টিতে দেখবেন। সকলকে ধন্যবাদ। থ্যাংকস টু অল।
Thank you very much, Dr. Mohammad Naseem Reza, sir, for enlightening to the interests of the students, especially by expressing your ideas in Bengali language. And I hope many of our students have been enlightened and they have been able to understand the various nuances of maintaining hygiene in order to counter or combat COVID-19 during this pandemic. We shall look forward to your association in the near future, sir. Please remain with us. Thank you very much, sir.
Thank you.
আপনাকে
Welcome. You
অসংখ্য
are most
ধন্যবাদ।
welcome. ধন্যবাদ।
Now, I would like to request and invite our next speaker, Dr. Sharmin Utpal. Madam, you are currently working as an associate professor in the Department of Pharmacy, BRAC University from the year 2014 onwards. You have successfully completed your PhD in 2013 from the School of Healthcare, Faculty of Medicine and Health, University of Leeds, United Kingdom. You have work experience at the United States Fund for Population as a program associate in the field of youth and adolescent reproductive health. You have clinical research experiences at the Bangladesh Institute of Research in Diabetes, Endocrine and Metabolic Disorder, Verdun, for 6 years, and have a number of research publications in both national and international journals. You have also completed your PhD in the Faculty of Medicine and Health, School of Healthcare, University of Leeds, UK, and Pharma for Jahangirnagar University, Bangladesh, B Pharma from Jahangirnagar University, HSC from Dhaka Board, and SSC also from Dhaka Board. You have also presented several papers at international conferences and seminars, and you also have to your name several number of publications. And today, we hope the audience will be enlightened by your deliberation on medicine to counter or combat COVID-19. May I now request you, Madam, to please deliberate on this issue. Madam.
Thank you, everybody. Thank you for inviting me in such a lovely seminars. I'm organizing this type of seminar for everybody online. And we all know that during this pandemic, we all are confined at home and maintaining social distancing. And this is for our betterment, for our safety. So we have to be very careful about this. So today's topic, combating COVID-19 by exercise science, nutrition and hygiene, which I really appreciate. It's a very important topic for this time. Today,
Madam, we can't hear you. Could you please unmute yourself again?
yes, sorry, I'm sorry. Can you hear me now?
So sorry, madam, for this interruption. Actually, I should be
Yes,
the one to ask you sorry for this, because there is a participant who is maybe unconsciously muting the resource persons. So I would
exactly.
like to request Tesh Singh, a participant, to please not indulge in such behavior, sir. Please. Thank you,
Okay.
madam. Please
Okay.
continue.
Thank you. Thank you. Can you hear me now?
Yes, ma'am. Please
Okay.
continue.
Okay. Thank you. So BRAC is the largest NGO, and BRAC University is sister and concern of BRAC NGO. And I'm working here. I have worked in adolescent reproductive health in UNFPA, United Nations Fund for Population. So now I'm working in autism and in different pharmaceutical issues like adverse drug reaction, side effects. So that's my field of interest. So before discussing about the drug factor on COVID-19, I would like to discuss something about the immunity before, during, and after the effect of coronavirus. So once the virus has spread widely within the body, our own immune system becomes the thing that more urgently threatens to kill us. That means our own immune system is threatened for us. So at the very beginning, we have to be confident that this virus cannot kill us. So mentally, we have to be strong. So now, at this stage, when we all are free from this virus, that means we all are fit physically and mentally. At this stage, we have to start physical exercising. We have to boost up our body immunity. And all the resource persons in this seminar, they talked about the importance of physical exercise. Like Muhammad Khairul Islam Khan, he said when an athlete, when the footballer, when the cricketer, like if it is a test cricket, if it is 2020 or day-long cricket, they have to play throughout the day. But if any person don't take physical exercise, then we don't have that energy to spend. So we have to be physically strong, and in that case, we have to be strong immunologically. Okay, so to boost up our body immunity, we have to do physical exercise on a regular basis. Mr. Khan has already addressed about the lungs strength. If we take the physical exercise regularly on a regular basis, then our lungs, our alveolar and alveolar, that will be strong enough. And with a small breathing, we can take lots of oxygen in one time, and we can inhale and exhale. So that's a practice we need to do every day. Number one. Number two, our food. In nutrition, that means nutrition. We have to be very much careful about taking our food during this pandemic, especially. Otherwise, I could have suggested you can take any food at any time and burn your extra fat by physical exercise. But at this stage, you have to be very much careful about taking your food. So please avoid the junk food like burger, pizza, all fat-rich food. So what we can do to boost up our immunity, we have to focus on like some vitamins, minerals. Vitamin C, like before that, we need to understand about the nature of this virus. This coronavirus, it's not like other viruses. By this time, we all know that, right? We have faced dengue, we have faced Ebola, we have faced SARS, MERS. So all those are dangerous, but the nature and the type of this coronavirus, that means this COVID-19,
Madam, could you please unmute yourself again?
exactly. That's why the World Health Organization, they declared it as pandemic. Okay, so we have to boost up our immunity by taking planned and proper food. Like in case of minerals, in case of taking vitamins, like this virus, like যখন আমরা hand sanitize করি, when we sanitize our hands, that is acid or alcohol. Okay, but we do our hand sanitization externally. That means same thing should be done inside the body. তার মানে এই ফুড সোর্সটা আমরা কোথায় পাবো? From vitamin C. Vitamin C will give us this type of acidic reaction in the body, which is threatened for this virus. That means it can kill this type of virus. So to boost up our immunity, we have to take lots of vitamin C. Vitamin source গুলি আমাদের rich হওয়ার দরকার নেই. Vitamin C source is our lemon, green chili, guava, any spinach, lots of vitamin C. Okay, and vitamin E is a very good source for this. Broccoli, any avocado, these types of fruits are rich in vitamin E. So if we take our food in a planned way, then we can boost up our immunity. Moreover, one important thing is zinc. We can take zinc supplement once a day. Zinc will increase our body immunity. So if we take zinc as a precautionary measure to boost up our immunity, it would be helpful for fight against coronavirus. Okay. Another thing is the world is looking for a proper drug to combat with this coronavirus. World is looking for the vaccines for this disease. They are doing their work. There are people, they are ready to serve the society. So let them do their work. And we have to focus on our own work. তারা তাদের কাজ করছে। আমরা তাহলে কিভাবে তাদেরকে হেল্প করতে পারি, বা আমরা কিভাবে আমাদের দেশকে হেল্প করতে পারি? কিভাবে পারি? আমরা আমাদের নিজেদের ইমিউনিটি বুস্ট আপ করে, আমরা সোশ্যাল ডিস্টেন্সিংটা মেনটেন করে, আমরা এই প্যান্ডেমিককে, এই স্প্রেড অফ ভ্যাকসিন ভাইরাসকে আমরা কমাতে পারি, যে কারণে লকডাউন দেওয়া হচ্ছে। এবং আমাদের এই সাউথ এশিয়াতে দেখা গেছে ইউনিভার্সিটি অফ School of Economics, England, UK, they conducted a research এবং ওদের ফাইন্ডিং হচ্ছে সাউথ এশিয়া, স্পেশালি বাংলাদেশ, ইন্ডিয়া এন্ড পাকিস্তান, এখানে আমরা একদম বিষয়গুলোকে লেজে গোবরে করে ফেলেছি। আমরা লকডাউন দিচ্ছি, বাট আমরা প্রপারলি কিন্তু বুঝছি না হোয়াটস দ্য মিনিং অফ লকডাউন। আমরা মনে করছি এটা আমাদের ছুটির দিন, আমরা কিছু সময় বাসায় থাকছি, কিছু সময় আমরা বাইরে যাচ্ছি। বাইরে যাচ্ছি কেন? আমরা চা খেতে যাচ্ছি, আমরা বন্ধুর সাথে দেখা করতে যাচ্ছি। বাট এই যে আমি জানি না যে আমার বন্ধুটার মধ্যে করোনার সিমটম আছে কিনা। ওখানে আমার পাশে একজন দাঁড়িয়ে একটা কাশি দিল, একটা হাঁচি দিল। এই ভাইরাসটা এমন একটা ভাইরাস যে সে বেশিক্ষণ বাতাসে থাকতে পারে না, বাট যখন কাশিটা দেয় তখন ইট ক্যান ফ্লোট ইন দ্য এয়ার অ্যান্ড আই ক্যান ইনহেল দ্যাট এয়ার। ঠিক আছে? বা আমি একজনের বানানো চা, বাইরে গিয়ে বানানো চা খেলাম, সে চা থেকে ভাইরাসটা আমার মধ্যে আসতে পারে। আমি একজনের সাথে শেক হ্যান্ড করলাম, সেখান থেকেও ভাইরাসটা আমার কাছে আসতে পারে। সো উই ডোন্ট নো দ্য সোর্স অফ দিস ভাইরাস। আমরা যখন একটা যুদ্ধক্ষেত্রে থাকি তখন আমরা কিন্তু আমাদের শত্রুদেরকে চিনি যে এরা আমাদের শত্রু, বাট এখানে উই ক্যান নট রিকগনাইজ আওয়ার এনিমি, যে ভাইরাসটার সোর্স কোথায়। সো আমাদেরকে, আমরা একটা অদৃশ্য শক্তির সাথে কিন্তু উই আর ফাইটিং। এবং দিনে দিনে প্রতি 24 ঘন্টা আমরা প্রতি দেশে দেখতে পাচ্ছি লাখ লাখ মানুষ মারা যাচ্ছে। ইন্ডিয়াতে এখন ডেথ অনেক হাই। ক্যান ইউ হিয়ার মি? ওকে। সো বাংলাদেশে বাড়ছে, মানে এই পিকটা এখন আস্তে আস্তে বাড়ছে। আমাদেরকে যেটা করতে হবে, আমাদেরকে মেন্টালি স্ট্রং থাকতে হবে যে আমরা ভালো থাকবো। করোনা ভাইরাস, ইটস লাইক আদার ভাইরাস, দো ইটস স্লাইটলি স্ট্রঙ্গার দেন আদার, লাইক ইবোলা। ইবোলাতে কিন্তু অনেক মানুষ মারা গেছে, কিন্তু এটা প্যান্ডেমিক হয়নি। ডেঙ্গু, অনেক মানুষ মারা গেছে, কিন্তু এটা প্যান্ডেমিক হয়নি। তাহলে আমাদেরকে মেন্টালি স্ট্রং থাকতে হবে যে এটা তাহলে প্যান্ডেমিক কেন হবে। আমাদেরকে তো আমাদের সায়েন্টিস্টরা বুঝিয়ে দিচ্ছে যে সোশ্যাল ডিস্টেন্সিং মেনটেন করলে, হ্যান্ড হাইজিনটা মেনটেন করলে, নিউট্রিশনটা মেনটেন করলে, আমাদের ইমিউনিটিটা বাড়ালে আমরা এটা থেকে পরিত্রাণ পেতে পারি। We can fight against this virus and we can get rid of this virus. So আমাদেরকে সেই টার্গেট গুলা নিজেদের প্ল্যান করে, নিজেদের আমি যতটুকু পারবো সেই অনুযায়ী আমাকে আমার পরিকল্পনাটা করতে হবে যে আমি দিনে এতটুকু এক্সারসাইজ করতে পারবো, আমি আমার ইকোনমিক কন্ডিশনে এই খাবার খেতে পারবো, আমি এইভাবে আমার লাইফস্টাইল মেনটেন করব, একটু দিনে একটু হাঁটি, আমরা একটু আর্লি ঘুমাতে যাই, আমরা ভোরে উঠি। এই লাইফস্টাইল গুলির মধ্যে যদি আমরা নিয়ন্ত্রিত লাইফস্টাইলের মধ্যে আসতে পারি, তাহলে আমাদের ইমিউনিটি বাড়বে। এবং যেটা আমি আসলে যেহেতু ফার্মেসির আমি আর একটু ডিপ সায়েন্সে একটু যদি কথা বলি, বাট আমি যাতে সবাই বুঝতে পারে, যে যখন ভাইরাসটা আমাদের বডিতে ঢুকলো, ইনহেলেশনের মাধ্যমে হোক যেভাবে হোক, যখন ঢুকে গেল, এটার মেইন টার্গেট থাকে কিন্তু আমাদের লাংস। এটা আমাদের লাংসকে এফেক্ট করার চেষ্টা করে, এবং সে কি করে, সে আসলে আমাদের সেলকে বডি সেলকে হুক করে, বডি সেলের মধ্যে হুক করে জড়িয়ে বসে থাকে। এবং সে 1 সপ্তাহ বা 2 সপ্তাহ কিন্তু সে সুন্দর করে উইদাউট গিভিং এনি সিমটম সে আমাদের ব্লাডে ঘোরাফেরা করতে পারে। ব্লাডের মধ্যে সে চলাচল করলো, এবং যেটা হলো আফটার 1 to 2 উইকস এটা তখন আমাদেরকে সিমটম গুলি দেয়া শুরু করবে। ওকে, ইট গিভস আস দ্য সিমটম। কি সিমটম? Then we will feel respiratory distress, we'll feel weakness, muscle weakness, numbness. So these are the symptoms, but it gave us 2 weeks time, isn't it? কারণ 2 সপ্তাহ আগে এটা ইনভাইট করেছে আমাকে, আমার মধ্যে এসছে, আমি বুঝতে পারি নাই। So what we need to take lots of vitamin C to fight against this invisible enemy. আর কি করতে হবে? আমাদের হট ওয়াটার, সবসময় গরম পানি খেতে ভালো লাগে না। এই যে আপা যে পানিটা খাচ্ছে, if it is hot water then it will fight against coronavirus, ঠিক আছে? কারণ করোনা ভাইরাস একটু গরমে ভাইরাসগুলি একটু সাসেপ্টেবল। সো এই জিনিসগুলি আমাদেরকে এভাবে প্ল্যান করতে হবে। এবং যখন সে ব্লাডের মধ্যে হুক করে, দেন ইট ব্রেকস দ্য সেলগুলি যখন ব্রেক করলো, তখন এই সেলগুলি রেপ্লিকেশন করতে পারে না। যখন সেলগুলি রেপ্লিকেট করতে পারে না, তখন ব্লাডে ফিব্রিন বলে একটা কোয়াগুলেটিং ফ্যাক্টর আছে, যেগুলি আমাদের ব্লাডকে আস্তে আস্তে কোয়াগুলেট করতে, এটা নিজের অটো ইমিউন সিস্টেম। হ্যাঁ, ফিব্রিনোজেন, এই ফিব্রিনকে সে লাইসিস করে, ভেঙে দেয়। দিস ফিব্রিনোলাইসিস কি হয়, তখন আমাদের শরীরে রক্ত জমাট বাঁধাকে ভেঙে দেয়, যেটা আস্তে আস্তে কোথাও জমাট বাঁধে, কোথাও বাঁধতে পারে না। এই সিস্টেমটাকে ইট ডিসরাপ্টস। এবং হোয়াট হ্যাপেন ইন দ্য লং রান, থ্রম্বো এম্বোলিজম তৈরি হয়, এবং ইট লিডস টু myocardial infarction, it leads to stroke, it leads to weakness of muscle, it leads to numbness. ঠিক আছে? So to prevent this type of disorder, we need to increase our body immunity before invading COVID-19. So we have to be very positive. ঠিক আছে? এই জিনিসগুলা আমাদের খেয়াল করতে হবে, এবং তাহলেই আমরা সুস্থ থাকতে পারবো, কোভিডকে আমরা দূরে সরাতে পারবো, এবং we can overcome one day this COVID-19. Thank you very much.
Thank you so much, madam. Thank you so much.
Madam, it was really a pleasure to hear from you. Elaborate so beautifully about how any layman could understand the impact of the virus on the body, and how our whole immune system itself betrays us once the virus gets into our system, into our physical body. And thank you very much, madam, for explaining it to us so simplistically, so that any of the any person, any ordinary person could understand and equip oneself to counter, or or maybe adopt measures to prevent the progress of this virus in our body, and then may not be also a threat to the others who are surrounding us. Thank you very much, madam, for enlightening us on how to use our own immune system as a counter to COVID-19. Thank you, madam. We would definitely look forward to listening to more from you in the future. Thank you, madam. Now, I would like to request our last speaker, Dr. Shoibal Chandra, sir is an assistant professor since the last 7 years in the Department of Physical Education and Sports Science, Jashore University of Science and Technology, Bangladesh. Sir has held post as an ex-assistant director for 7 years at Bangladesh Public Administration Training Center, Dhaka. Sir has also been an ex-football coach in the Bangladesh Krira Shiksha Pratishthan, Bangladesh Institute of Sports, Dhaka. Sir has also been a lecturer in the Department of Physical Education, Uttara University, Dhaka. Sir has completed his BPE, MPE diploma in yoga from Banaras Hindu University, India, diploma in football coaching from NSNIS Patiala, India, diploma in biomechanics, KISS with CPI scholarship from South Korea, diploma in conditioning coach, Leipzig University with federal scholarship from Germany, MBA in sports marketing from Bedfordshire University, JICK scholarship from United Kingdom, and Sir is also pursuing PhD from Vishwa Bharati University with ICCR scholarship, India. So Sir has a long association with India, and Sir has completed several training in national and international institutes. Sir has several publications in journals, and Sir has also attended several national and international seminars as well as workshops and conferences. And Sir has licensed to 3 licenses as captain football team in Banaras Hindu University. Sir has been long associated with. We are very much privileged to have with us Dr. Shoibal Chanda as our invited speaker today, and Sir shall be deliberating on the issue of combating COVID-19 through exercise science, nutrition, and hygiene. Thank you very much, Sir. May I now request you to please deliberate.
Thank you, ma'am, for to invite me for this speech. First of all, I would correct myself. I am not. I haven't been awarded yet. It's pending due to COVID. So please don't use doctor before my name. However, honorable Vice Chancellor, Director, yes, ma'am, Director of Higher Education, Principal ma'am, and the speakers of this seminar, particularly Khairul Islam Khan sir, who is the living legend of physical education and sports science in Bangladesh, and one and all participating in this webinar. Good afternoon. And today, since I am a man of physical education and sports science, I won't go beyond my box. I will think everything within the box of my academic field. And when we go for any competition, we know about our opponent, his technique and strategies, what he's going to use on me or my team. In the same way, since we are combating with the COVID, so we need to know a bit about their COVID and COVID strategy, how they attack us, how it attacks us. Then let's know about the COVID or pandemic or Wuhan Chinese virus, whatever we say. Actually, its disease name is COVID-19 because coronavirus disease, it's the name of the disease, COVID-19, and coronavirus disease 19 is the full name of COVID-19. And it came from the Latin root, that is corona means crown. And virus name is the SARS, CoV-2. And SARS means severe acute respiratory syndrome. And if you look for looking, how does it look? It's a spike in the sports. We use spike balls for the muscles. It's like a spike ball, or we can also say it's like a thrown apple, means dhutrar beach. Amra dhutra bole shobai chini most probably. thrown apple seed. Actually, there are 7 types of coronavirus which can contaminate, infect us, but among these 7, 3 are most dangerous. That is SARS, MERS, and COVID-19. Other are less dangerous to the human. And to know the structure, it is covered by 4 types of protein and single-strand RNA. It has single-strand RNA, and the 4 proteins, especially the spikes protein, that attach with the cell membranes. S2 receptor. S2 means angiotensin converting enzyme receptor 2, and this receptor present in lung, heart, and kidneys, as well as in intestine. And how does it spread in our body? Just in layman language, if we see virus spikes attached with the S2 receptor of the cell, especially endothelium and epithelium cell of the alveoli of the lung, and enters into the cell, deceiving the receptor and release RNA into the cytoplasm of the cell, and hijack the whole mechanism of the cell and enter into the nucleus and produce lot of RNA, and then come out and enter into the endoplasmic reticulum and Golgi apparatus to receive some protein which it needs, and assemble as a new virus, and the virus come out in the bloodstream through the circulatory process. And now, how does our immune system fight against this COVID? We fight against this COVID in 3 different ways. That means 3 stages of immune system. First is the barrier, on which previous speakers have discussed so many things by which we can improve our barriers, like using masks and sanitizers and other things. And this is the support. But even then it fails, because these barriers are especially the skin. First, it defends from so many bacteria and viruses and phagocytes, and then even it comes into the nose, and then lining of the nose, pharynx, and urinary system. All these also fight against it, but again, to corona, it fails. Then comes to the respiratory cilia of the bronchia and bronchioles. We know those who are in the field of physical education. So I'm thinking everyone do understand, since we are all from this background. So these are one way they throw them out, but these ciliars also fail, and it goes further. And there are respiratory tract surface mucus. Those mucus also attach, and they release some antihistamine, and those antihistamines also kill. But for the COVID, that doesn't also stop them. And another thing is we get contaminated through our eyes. Though there are eye tears, eye tears also has antimicrobial protein that kill also virus. But here eye tears also cannot stop them, and we do blink every time to keep this process continued. But all this process, our barrier immune system fails. Then it enters into the body, then comes to the innate immune system. And innate means inside, and net means born. That means by born which we acquire, those are innate immune system. Usually we get from our parents, and they acquire it from evolution, and it is non-specific, react against almost everything in the same fashion, and fight against all foreign bodies which enter into the body. And the cells are in this immune system, that is WBC, white blood cell, also called leukocytes. And these are some neutrophil, mast cell, basophil, dendritic cells, and eosinophil, monocytes, etc. And there are also killer cells. And in this process, complementary system also works. In the complementary system, that means activation of antibodies take place, and those antibodies go and clump with the protein of spike protein of the virus. If we see innate immune system in the children, we'll see they have very high level of innate immune system, and for that, when child get contaminated, their death rate is much lesser than the other adult or suffering several diseases like diabetics, hypertension, chronic kidney disease, coronary heart disease. And ultimately we can see while decrease in innate immune system result in increase in infection. And last on the acquired or adaptive immune system. And this is a specific one and target the specific foreign bodies and fight against it with cell or antibodies. And these cells are T lymphocyte and B lymphocyte. And they attack gradually. This is a slow process, but once they come to know about the nature of the virus, they never forget for whole life. And whenever in the next time they enter, first they go and attack those viruses. And function of this acquired or adaptive immune system, if we see first, interferon. Interferon is an antiviral protein that released by the dying cell into the blood to alert nearby cells to create environment generating protein inside themselves so that they don't get affected. And interferon also works on T cell. It recruits cell for cytotoxic activities within the cell. And for the B cell produce antibodies that coat a virus spike, that also called opsonization. That means like putting some coat over a chocolate to make more tasty. And now this tasty thing is eaten by the neutrophil. And antibody also inhibit interaction with the other new host. That means the other cells. Even if that virus goes inside the cell, lymphocyte and neutrophil eat viruses. And just before Madam talk about these things, cytokine storm happens that is more fatal than the virus, which happen within the body and because of the defense mechanism. And by the beside that, killer T cell is there who comes and kill the whole cell. And this whole killing and infection, fluids drains out. It's watery fluid. Those who have gone through any surgery, they have seen after 1 day or 2 days, water-like fluid comes out. Same thing happened within the alveoli. And this watery fluid solidified. Then comes the real scenario, that is breathing problem for the patient. So this is the function of our acquired or adaptive immune system. Now let's see exercise intervention on COVID, by which exercise intervention we can keep ourselves in a good position. there is a contentious about the excessive aerobic activity among the researcher. A few researchers claim that doing marathon-like extensive activity reduce immune system, but several other researchers disagree with this finding. But to me, it is identical that if you go for prolonged strenuous aerobic activity, it will result in higher cortisol level in the blood, and that is a stress hormone that will stress you up, and you will face insomnia. So being over motivated, we should not go for excessive aerobic activity, or we should not suggest our clients to do any extensive activity in this COVID if he is a layman, not an athlete. On the other hand, extensive strength activity, that is also not recommended, because excessive strength activity depletes the testosterone storage, and that depletion result negatively on the immune system. That means we should not go for extensive or excessive aerobic and strength workout. But if we don't do any activity or do very little, surely that won't help you, and surely it will reduce your immune system. Then what to do? That's the question to ask in the those who are handling exercise science. That we must suggest to do moderate exercise. It's a critical thing, individualized. Those who are expert in our field, they can suggest their client what is the moderate exercise for that particular individual. Tridip Chakraborty, kindly would you please, thank you. And moderate activity, for doing moderate activity, as my earlier speakers told, doing exercise, walking, jogging, cycling, those things, suggested obviously in the home, but usually we go outside. That's convenient for us and we are used to. But at this scenario, we cannot go outside if it is crowded. So what we can do at home, that's the question to us. We can do some yoga in a very limited space. Everybody is not privileged with a big house. Even if we have a place to sleep, that we also can use for yoga, like asana, pranayama, and meditation in particular. I'm not emphasizing other yoga practices. For the laymen, those who are not used to with the yoga, to do at home without any supervision. And another thing is the aerobic exercise. If you don't have any treadmill or bicycle, so you can do some aerobic exercise, stepping exercise, dancing exercise within the room, in a small area, with the whole family. And third thing is the plyometric exercise. So plyometric exercise means using own body weight for the strength activity, not using any weight apparatus. But we can do it in a small space. We know how to increase degree of difficulties for, and we can suggest for individualized workout, plyometric workout. Those who are expert in our field, they are well equipped with this knowledge. But we also can do some sort of strength activity using household things like water bottle. We can take 2 liter or 1 liter water bottle. We can do exercise like dumbbells. We can lift any bag or bucket or chair or whatever it is nearby. We can use those things also for the strength training. those we have to think in the improvised way what the best we can do being at home. And these things are suggestible before being positive or not being if you're asymptomatic, you can do those things because still those activities will help you out. But once you have found positive, I must not recommend to do any sort of physical activity. And reason is that demand of oxygen would increase due to workout. On the other way, if you are positive, your oxygen demand supply is struggling, alveoli are blocked, so you will put extra load on the lung, so that altogether lung and total cardiovascular system may fail and may be fatal for you. So I must not recommend to do any sort of activity if you are found positive, and I would recommend straightway talk to physician, those who are expert in handling COVID-19. And next is the exercise hygiene. I must, Dr. Nasim Reza sir discussed about the general hygiene. I would emphasize on the exercise hygiene. In the exercise hygiene, mask, we use mask, and there mask, there is a problem. That is, you get less oxygen due to mask, and during exercise, demand will increase. So what to do? We should use mask to go outside, but not during exercise. If we can do exercise in the open field, if there is nobody, but if it is crowded one, we should not go for activity over there. Secondly, if we inhale, putting mask and do exercise in the crowded place, what will happen? Normally, a percentage of oxygen saturation in the blood should be 95 to 100 mmHg, and less than 90 is considered as low, and less than 60 mmHg is a problem for us, and oxygen supplement is required, and you will put strain on brain and diaphragm, and hypoxemia, that means shortness of breathing, you will suffer, and it also can be life-threatening for a person who is doing exercise for prolonged period with putting mask over his face in a crowded situation. On the other hand, what the carbon dioxide will exhale, that will not pass properly through the mask, and will inhale back or exhale carbon dioxide. From the free air, normally we breathe only 0.04% carbon dioxide from air, but if for an adult, this in the blood level of the CO2 goes beyond 22 to 29 millimole per liter of blood, that is fatal for him, and cholesterol level increases because of that. Adrenal gland gets affected, and kidney gets affected, and that person may get confused and disoriented. So we should be careful of this also. And madam discussed about the nutrition. I must not take much time since it is the lunch time and number of the participants are reducing as I am watching. So important vitamins, mainly 6 important vitamins help us directly in the immune system: vitamin A, B, C, D, E, and K. So we can find all those things from our food. So I'm not discussing elaborately all these things. And in the in the COVID situation, we need to modify our lifestyle. And my suggestion, there are 5 suggestions from me. That is, adequate sleep. You should sleep at least 7 to 8 hours, and you should do moderate physical activities, and you should manage your stress. Means also, and another next thing is the hydration. Body should keep hydrated always, because otherwise immune system won't work. Vitamin and minerals won't be in a good environment to work his own duty, to fulfill its own duty. That's why our body should be hydrated every time. And how to check whether our body is hydrated or not? I'm not talking about the diagnostic process of other complicated thing. In a layman way, what we can do everyday life, that is, we should check our urine color. If it is as like as water, close to water, that's fine, your body is hydrated. And if it is more strawish than straw like color, so that means your body is not properly dehydrated, and you should hydrate it. And don't wait to be dehydrated to hydrate your body. It's a continuous process. Everybody should keep hydrated always, their body. And last thing is the nutrition. And I would recommend not being very specific, only 3 serves of fruits. And we should select fruits in different colors. 3 serves means if we make our hand in a cup shape, what would come in the cup, that is 1 serve. So like 3 serves only per day. And vegetable, that is leafy and other vegetables, those should be also purchased from the market, targeting different color, and should focus in the meal. There are different color of vegetables, and leafy vegetables too. And also should take low carbohydrate diet as well as low fatty diet, because these things, excessive intake of these things affect adversely on our immune system. And thank you all. If you have any question, queries, please, you are welcome.
Chandra sir, for discussing in detail, in elaborate length, how to understand the present scenario and how could that affect our fitness, our survival strategies, because every strategy that we are applying in order to counter the COVID-19 pandemic is failing, I must acknowledge. And therefore, I would like to thank you very much for elaborately explaining how exercise, which is definitely considered as a source of counter against any kind of physical ailment, or which could support the development of physical health, could be also seen as a disaster. Am I audible, sir? Okay. Okay.
Yes, ma'am, you're audible. Yes, ma'am.
Well, I can't hear myself. So, from your lecture, sir, I could understand that exercise without proper precautions could also result in disaster for a person. And therefore, we should be aware of resorting to the adequate and proper measures in order to maintain, or in order to equip ourselves with the right form of exercise or right form of survival strategies during this pandemic. Thank you very much, sir, for enlightening us on this issue.
Welcome, ma'am.
Now, I would like to request. Am I audible?
Yes, ma'am, you're audible. Quite audible.
Madam, am I audible? I can't hear myself.
Yes, ma'am, you're quite audible. Ma'am, you are quite audible. We can hear you properly. Please turn on your mic. Please turn on your mic, ma'am.
Thank you very much, sir, once again. And in the chat box, there is a question which has been put forward to you, sir. It is from Dr. Parthasarathi Debrai, and it goes, which training heart rate is required for combating COVID-19, sir? When you say about moderate exercise, so can you please mention this? That is training heart rate. Please enlighten, sir.
Uh, Thank you for your question. And actually, yet no research outcome tells that this particular exercise or this level of heart rate would be appropriate to handle COVID. This is the cruel reality. But I think if you maintain your pulse rate at least 100 above 102 and between 130 120 to 30, and those who are fit enough, they can go up to 140 for certain time. That would be moderate. But again, I told, and previously I told, that is, it is totally individualized factor. If someone is having heart disease, for him moderate could be even 100 or 105. So that before exercise is like medicine, I must recommend those who are interested to do physical activity at home or outside, now or after, they should obviously consult with the expert who are working in this field, like physical education and sports science. Otherwise, this exercise also can be fatal for him because it's completely individualized. Thank you, sir. I think I could reach to your question.
Thank you very much, sir, for explaining the question in a very
Welcome,
simplified manner, sir. Now, there is another question which has been put forward to Charmin Madam. So, if Charmin Madam is available and if she's still on the call, can you please enlighten us on this question, Madam? Charmin Madam, could you please unmute yourself? The question from Sri Parthasarathi Chakraborty goes, how does coronavirus changes our own immunity that leads to kill our own body? Most probably you must have addressed this question during your lecture, but could you please enlighten us again?
Exactly. So what I've said in my earlier discussion that there are different species of coronavirus, virus A, B, and C. Every species is not fatal. So when coronavirus attacks the people, some people say that, yes, I have the symptom, but I overcome it. So they're fit, they're okay. But in some cases, people feel very weak, very numb, and some people, you know, they die. So there are different species of coronavirus, A, B, C. So if coronavirus attacks us, its area of invading is pharynx or lungs, that area. It loves that area. Okay, so it hooks the cell in that area, and what happened? It hampers blood clotting that I've said, and by that way it just reverse our immunity, body immunity. So clotted blood that stucks in our blood vessels, and that clotted blood vessels leads to thrombosis. Okay, and that clotted blood affects our lungs, our heart, our renal system. Okay, and that there is a marker called D dimer. If coronavirus attacks us, that D dimer will be 4 times higher than the normal position. So if coronavirus attacks us, there are different biomarkers by which we can understand or we can predict that yes, we have been attacked by the virus and we have to treat against this virus. So that's how the immunity changed because of the attack of coronavirus. Okay. D-dimer is one biomarker, another biomarker is cytokine. So there are different types of biomarkers, and those indicates that our immune system has changed because of the attack of coronavirus. Thank you.
Thank you very much, madam. I hope the question has been aptly answered. If there are any more questions, the participants are requested to put forward their questions in the chat box, and we will definitely put it forward to our resource persons. The chat box seems to be full of compliments for the resource persons, complimenting on their deliberations, complimenting on how the seminar or the webinar, because this is a new platform where we have transformed ourselves, or where we have changed from the real to the virtual world. So besides the various technical glitches that we had experienced during the process of this webinar, I hope it was a very delighting, a very engaging session, a very informative and educative. Besides trying to answer to all the inquisitive questions, all the queries that the participants must have expected out of this webinar, I again take this opportunity to thank our resource persons who have been kind enough to accept our invitation to be the speakers for our webinar, and who have kindly consented as well as performed in their most abundant way and addressed our participants on how to combat COVID-19 through exercise science, nutrition and hygiene. Thank you very much, madam. If there are no more questions to be put forward, yes, there is a question that has just caught my sight, and this is a question from Preetam Debnath, a student of Netaji Subhas Mahavidyalaya. Chando sir, please can you tell me if anyone very fit but he is corona positive patient, so how fast he can be relieved of this disease? Well, this
Thank you,
question has
ma'am.
been put forward to Shoibal sir, please.
Yes, could you repeat it, ma'am? The question.
The question here goes, Chanda sir, please can you tell me if anyone very fit but he is corona positive patient, then how fast can he relieve himself of this disease?
I would refer this question to madam, because madam is the right person to respond with this question. But I can, but since he is available and expert in this arena, so I would.
Definitely, sir.
Okay. Okay, so it's a nice question. Actually, what happened? We need energy, and glucose is the main source of energy, isn't it? We all know that. But during this situation, if we take lots of carbohydrate food, that means our body will be busy to break down that glucose. But we need to engage our immune system and all body system to combat with COVID-19. So in this time, if we are fit, we need to restrict our carbohydrate intake. And we need to take the foods which gives us improve our body immunity. That should be our focus point. Okay, that's the main thing. Even if we are fit, we need to focus on that issue.
Madam, there seems to be more questions coming up in the chat box, and I hope our speakers would be obliging enough to answer those too. How activity can reduce stress? Can you explain, sir or madam? Because we are staying at home since a long period of time.
Yes, it is. Is it question to me or ma'am?
Okay, okay. You can go ahead. I can
Okay,
add
thank you.
something after you.
Okay, thank you. Actually, stress management is a big issue. In a nutshell, I would say that if you do some meditation, then it will help you to reduce your stress. And stress is not at all a problem. There should be stress to be aware of the circumstance or environment. But if stress takes me out, there's the problem. We should not surrender to stress, rather we should use stress in a positive way. But there are certain conditions when we fail to control, and stress controls us. Then only way is, that is, if you do some sort of meditation and other things, like physical activities, that also reduce. There are several other measures, and there are other techniques also. Think positively, and there are so many stages. I cannot go for all this discussion, but in a nutshell, I would say, if somebody is stressed, easiest way, if you know, go for a few minutes of meditation. Or if you don't know, who is known to you working in this profession of physical education and sports science, take help from them. He will help you individually. That would help better, is my view. Ma'am, if you can add up something.
Okay, thank you, Shribal. Thank you for your points. And if I want to add something, that in a scientific way, that in the brain there is a pituitary gland, isn't it? So every time we need to convince our pituitary gland, we need to give positive impulse to our pituitary gland that we will be fit, we'll be happy, we'll be stress-free. What's happened during this coronavirus? Every time we need to be positive that our immunity will be higher, our body will be fine enough to combat with, to fight against this virus. So this is the positive impulse that we need to put or send to our pituitary gland. Number one. Number two, that you said that meditation, it's a good exercise that for our soul, for our mind, meditation is a good practice. Physical exercise, do you want to add something? Okay, so these are the things we need to consider to reduce our stress during this pandemic. Another thing I want to add, the importance of positive impulse. Like when my fathers have gone to bypass surgery, that is general anesthesia, we all know that. But after the completion of surgery, the physician, he came out from the operation theater and said, the patient supported us a lot. Then we were astonished how the patient supported him, because the patient was full anesthetized. But his mental input, mental positive impulse supported the physician for that surgery. So this is the thing, we have to be positive about this pandemic. That's the main thing. And every time I tell it to my children, to my daughters, that if you are intelligent enough, if you are clever enough, you have to find out your own way. Don't be stressed, don't be bored, because nowadays the children, they love this word, I am bored, I am bored. So if you are intelligent enough, you have to overcome this situation by your intelligence. So find out your own way, how you could be happy, how it could utilize your time properly. Don't be stressed, don't be depressed. You have to utilize your time properly and in a valuable way. So you have to find it out. You can discuss it with your friends, you can discuss it with your peers, but you have to find it out. So you
Ma'am,
yourself can help you. Yes.
ma'am, here I want to add up one example. Actually, it's not example. An example is the experience of mine. What happened with me and how positive thinking, as Madam discussed, brought me out. That is, once there was so rush on the highway, I had to take a bus, and in which there was no space to stand. Such a crowd was there, and it was totally hot and humid, like June or July in Bangladesh. So how terrible it is, and I had to move for 2 hours at least, in this situation. Then it was very painful to me to tolerate that hot and condition and pressure, human hot and natural hot all together. Then I start thinking, why don't I think in that way? How, in this situation, how do I feel? Let's feel it. And I felt that 2 hours and experienced that situation, and finally I came to my destination. And it is really a great journey for me in my life to realize that situation. So we should take stress or situation in this positive manner. That wasn't just example. Every situation would be different, and for everyone it would be different. We have to take specific situation. That's my suggestion. Thank you, ma'am.
Thank you very much, sir, for enlightening us on this question. There is also another question from Dr. Sanjay Kumar Singh of Varanasi. Uh, the question is addressed to Madam, and he wants to know how to test immunity. Is there any testing parameter to measure immunity, Madam?
Yes, that I've told you that there are some biomarkers in the body, like that is 4 times higher in COVID situation. There are cytokines that could be flooded the blood when this virus attacks us. So testing these certain biomarkers or parameters, we can make sure that our body immune system has been changed by the attack of this virus. So there are certain tests available. Yes.
Thank you very much, Madam. I must acknowledge the fact that being a physical educationist, you do have amassed knowledge regarding medicine too, and therefore you are able to enlighten us on every question that is being put forward to you, Madam. Thank you very much. These are the questions probably in the chat box. Okay, there is another question. For how many days maximum the virus is alive in human body? Madam? Please unmute yourself.
Yes, yes. That I've already told that without giving us any symptom, this virus can play in the blood 1 week to maximum 2 weeks. Then after 2 weeks, it can give us the signal. Okay, so we can have the symptoms after 2 weeks, that our muscle weakness, our appetite loss, our headache, those are the symptoms, initial symptoms, our throat pain, fever. So without giving any symptom, this virus can float into our blood for 14 days. Okay, that's why আমরা কোয়ারেন্টিনে থাকতে বলি for 14 days. Yeah, 14 to 21 days. The quarantine থাকো. If you have any symptoms, then it will come out. So without giving us any symptom, this virus can stay in our blood for 14 days. It will be alive. And another important thing is nobody asked me, but I want to add it. We have a question that is it alive in dead body? And when human is becomes dead, that means the virus must, because it needs a host which is alive, isn't it? So dead body is dead. So how can it survive in the dead body? So why should we fear to bury the dead bodies? Eh? The answer is yes, and the same time answer is no. Why? Because this virus is invented in China for the first time from a dead body. Okay, so from that record and from many other records, it seems that the virus is still alive in the dead body for 6 to 12 hours. So we have to handle the dead body for showering, for preparing the dead body to bury for 6 hours or 12 hours. And that virus can survive during that period. So the answer of that question, is it alive in dead body? Maybe yes, maybe not. Okay, so there is a risk. To overcome this risk, the persons, those who involved for burying these dead bodies, they have to take PPE, personal protection equipment, to protect themselves. It is very important. But usually what happens? They shouldn't survive in the dead bodies. But because of the strain of this virus, if it is C strain, not A, not B, if it is C strain, that means very harmful for the human body. It may survive for 6 hours to 12 hours in the dead body. So we have to be very careful about that. That's all.
Madam, actually, after 2 weeks, the virus will be effective. Okay, but how long it will be alive? It depends on the immunity of person to person, individuals. After 2 weeks, that will be alive, but how long it
Exactly.
will be alive in our body if I am COVID affected?
Exactly. Yes. As long as our body can produce antibody for this virus, then it have to be diminished. Okay, so within total 21 days or around that time, the antibody comes into the blood. Okay, when once antibody comes into the blood, that means we have the self-immunity produced to fight against this virus. Okay, so a COVID person should wait till the antibody forms inside the body. Yes, exactly.
Thank you
So
so
maximum 21 days. Yes.
Thank you very much, madam, for kindly consenting to answer all the questions that are being put forward to you, and to all the other resource persons also for enlightening us. Ma'am, there is a question here. Could you please take this last one? Ma'am, what's the cause of male death ratio more?
Okay. Actually, in Bangladesh, in the television, every day I see that for the last 24 hours, auto death occurred, and among them, 70% is male and 30% is female. Okay, so actually, there is no statistics that whether male are more vulnerable than female or not. Okay, since our male population ratio is higher than the female, so male people are attacked mostly than the female people. But there is no specific statistics that male are more vulnerable than female. Like initially, it was we thought that only the elderly people will be vulnerable. That the people above 60, they will be vulnerable. Because their lungs will be weak, their immunity will be weak, so they will be. But nowadays we see the people at the age of 30, 40, 50, they died because of this coronavirus. So there is no statistics whether male is vulnerable than female or whether white is vulnerable than black, or Caucasian or Asian is vulnerable than Caucasian, because it is a new research area. And many people said, what would be the long-term effect of this COVID-19? There is no statistics, there is no result, because this is not, there is no possibility of conducting research for a long time, isn't it? So people think that yes, it may produce long-term effect, like it may hamper our respiratory system for the long time. It may affect our renal system for the long time. So to overcome the normal breathing system, to overcome the normal renal system, it takes time. Okay? So that's
Thank you very much.
I want to add here one thing, if you permit. That is why the death of man is more than women. Actually, as Madam said, it is completely obscure. We cannot say anything specifically, but some prediction we can make. Some studies suggest before 9, female mortality is more, but after 9, male mortality is more. 9 years of age. That means immune system of the male gets weaker after 9 years of age. On the other hand, if we see in not only in the South Asia, in Western countries where there is no gender difference, even then male stay outside more than the female, and they come more with the coronavirus exposure. That's why probably death rate of the male is more than the female, but that is again probability. Thank you.
Thank you very much, sir. If I'm not too asking, could the speakers take just one last question? This question is put forward to Madam, and the question goes, if the virus is spreading through currency, then how do we sensitize that? This is a question concerned with hygiene, and I personally feel Professor Nasim Raza would oblige to answer this question. Sir?
কারেন্সি টাকা পয়সা দিয়ে যদি আসে সেটা টাকা পয়সা দিয়ে যদি সেটা করোনা ভাইরাস আসে তাহলে আমরা কিভাবে এটাকে ফ্রি করব?
Any of our resource persons could answer this question.
Could you repeat, ma'am, the question? I couldn't
the question is, sir, if the virus is spreading through currency, currency, then how do we sensitize that?
Okay, nice. I must not suggest to throw off all the money, but in India, especially, use of card is more than the than the Bangladesh. So in terms of India, the Indians, they have more opportunity to use card. So if they use card, and immediate after that, if sanitization is made, then chance of getting contaminated is less. On the other way, if you go outside, use your money from the wallet and take back all these things, and if you keep it outside, it's dangerous. But you can, if there is a strong sunlight, then you can keep those things under sunlight, because one study suggests UVB ray kills the coronavirus if you expose it for more than 5 minutes of time. So you can 5 or 10 minutes you can wait with the money, leaving those under the sunlight, and get back. And if it is a big sum of cash, then you can spray also some sanitizer. Those doesn't adversely affect on the print of the currency. But you must sanitize. Thank you, ma'am.
Thank you, sir. I hope those are the questions that have been put forward by the participants. Well, the question on whether the COVID-19 has affected the brown and brown people mostly, as it was recently found in the USA and the UK, has already been answered by our resource persons. So that do not have to be addressed once again, I believe. Anyways, I thank all our resource persons for obliging to answer all the questions that have been raised forward once again. It was so lovely to listen to all of your ideas. We have been truly enlightened by your informative lectures, and we also look forward to more associations in the future. Thank you very much. Now, I would like to request the convener of the one-day international webinar on combating COVID-19 through exercise science, nutrition and hygiene, Dr. Ravindra Kumar, Assistant Professor as well as the Head of the Department of Physical Education, Netaji Subhas Mahavidyalaya, Udaipur, Gomati, Tripura, India, to propose the vote of thanks. Please, sir.
Good afternoon, all of you. Good afternoon, all of you. As a convener, International Organizing Committee, I will give thanks to resource persons, our respected VC sir, our respected director sir, principal ma'am, organizing secretary, actual Debbarma ma'am, Teachers Council Secretary, Dr. Subhas. I am also grateful to Professor Nasim Khalil sir. They have discussed regarding the how can keep immunize oneself and how can keep our society immunized more and more regarding this panic situation. And Professor Nadeem sir also discussed regarding the SMS tissue paper importance, mobile sanitizing, like that. And madam, I am personally very thanks to madam. Discuss so many points.
Thank you. It's my pleasure. Thank you very much. Thank you for inviting me.
And Saibal Chanda sir discuss physiological aspect of how to develop, immunize any individuals, how to develop our society, and how to protect through exercise and develop our immunizing power. So, in the last moment, I will give a lot of thanks to all of our resource person, VC sir, director sir, principal ma'am, organizing secretary, PC organizing secretary, NSM, and I am also given a lot of thanks to our directorate, Rusha department. Those are given facilities. Avir sir, those are given facilities to technical wings to organize the seminaries in a smooth way. And Directorate of Higher Education, those are given and give to me privilege to our college, we all of us, to give the privilege to smoothly conduct this international webinar. In coming future, maybe we also make a plan and move forward for another international webinar, and I will hope all resource person may be again meet with us and sharing each and every aspect of the any topics. Lot of thanks given to all participants, those are participate in international webinar and asking questions and that questions are very impressive, and from that questions we can collect more and more information for individuals and for the society. Lastly, lot of thanks, and I am conclude this international webinar. Again and again, I am giving thanks, lot of thanks to all participants, all resource persons. Namaskar. Thank you. Jai Hind.
Thank you, sir. It was our pleasure to be connected with you. And I extend from all four behalf of all four speakers and Bangladesh, I extend my grateful thanks to invite us in this webinar and wish everyone the best health and mind and wealth. Thank you all.
Thank you all very much
Thank you all
for
very
your
much
active
for your
cooperation and for your consistent solidarity towards remaining till the end of this webinar. I would like to thank our resource persons, especially for sparing out of their very busy schedule and kindly consenting to be a part of this webinar in sharing as well as getting all the experiences to themselves too. This was a wonderful sharing experience for both the resource persons and the participants, I believe. And through this webinar, we have been able to delimit our sources or our areas or our horizons of learning. And social distancing is something which should be an obsolete word now, because we are more connected to each other during this pandemic through this webinar platform, and we shall continue to be connected to each other hereafter. Thank you all, and namaste to the international participants, the international resource persons. We hope you will take a substantial experience from this webinar. Thank you all. I request all the participants to fill up the feedback form without any wrong entries, because the feedback form will generate your e-certificates instantly. You would not even realize that you have already entered the feedback form, and the e-certificates will already be sent to your emails. In order to counter any kind of wrong entries in your e-certificates, kindly fill it up correctly. Thank you all. With the permission of the principal madam, I would like to conclude this webinar. Thank you. Thank you all.
Thank you very much. Thank you.
Yeah, yeah. Huh. The webinar has been formally concluded, and the participants may now engage in an informal interactive session if you would like to. The organizing team are still there online, and you may connect to us through this platform. Feedback link फिर से देना पड़ेगा ना. हाँ, I have shared the link to the feedback form once again. All the participants who were not able to make their entries earlier can enable it now. Thank you all. The webinar is formally concluded here, and I'm closing the session now. Thank you.